Okay, so today I'm going to talk a little bit about, try to squeeze you all in a little corner here. Okay, so I only see you, Clara. I'm going to talk about the impact that sex and gender can have on digitalization in healthcare. As you've heard, my home discipline is medicine, but then I moved a little bit further at the borders of this. I explored the clinical work. I also explored basic research and public health. And then I moved a bit into the field of organizational work as well, because I think if you try to implement something that's new to the field, you also need to take into consideration other aspects that are structural and that help us implement these things. So what I will talk about today, if this helps me, okay, I have to use the arrow, is, well, how we went from one human body to hopefully at least two, if not more. So how did this story start? The first point was, for centuries, this has really been the human body, the body that we've investigated in healthcare, which was the measure of all things. And then something marvelous happened, and about, let's say, 30 to 40 years ago, we started realizing that also for medicine, there's at least a second human body, if not many others. So that was quite a surprising fact. And also somewhat uncertainty came up with it. So the problem was, well, we have at least a second human body, so what do we do? How do we deal with this, and what does that mean for us? So we came up with a relatively easy and, if you want, smart solution, which was this. So everything that was under that bikini from now on was to be investigated separately because, yeah, it's evidently different. But everything that was not under that bikini could just stay the same because it's not really that different. Although the idea does not seem that off, it proved not to be the ideal solution to the problem. And what does that mean? This is from a textbook that most physicians know. It's a lot of drawings done by an incredibly talented man who was a physician himself, so Professor Netter, who did an amazing array of figures and of representations of organs, of diseases, and he gave us a lot of these pictures, which within a second point out all the important things you should be knowing about a disease if you're a physician. As I said, he's incredibly talented, and for decades, students of medicine have seen these figures and have studied on them. But what you see here is the heart attack. So this is what comes to mind when you see a heart attack. This is what you should be knowing. It's a person who's slightly overweight, just came out of a warm restaurant where he probably had a heavy meal. He's probably also smoking. As you can see on the ground, there is a cigarette. He comes out and he feels pain in his chest, irradiating to his left arm and probably to his jaw. Well, this is a quite typical presentation of the heart attack, but by now we know that it's not the only one. We know that the heart attack can also present without the chest pain, without the pain in the left arm. It can present as nausea, it can present as back pain, it can present as dizziness. And it turns out that for women, these presentations are much more frequent than for men. This does not mean that women don't have chest pain. Women can also have an absolutely typical presentation with the chest pain and the pain in the left arm, but if the presentation is not typical, it's much more likely to occur in women. And by now, we also know that the heart attack is not a male disease, so we could as well have a couple here. And that at least 40% of the patients are women, not exactly 50-50, but it is definitely a disease that affects women almost as much as men. So what does that mean then for us? If you try to Google today, heart attack, this is what you see. So just take that as our collective unconscious mind and the images we're fed every single day, and then try to count the first 100 images and see what you see. So of those first 100 images, 96 are men. There's quite a diversity in men, so that's good, at least here we progressed. And there are 4 women. And of those 4 women, one is there twice. So it's actually 3 women. So if we take that into consideration, we have learned a lot, and we have definitely moved on when it comes to the science. And yet, although in the general population there is quite an awareness today that heart disease affects women as well, we're definitely not there yet. And this isn't just true for the heart attack. So, as I said before, we can start with this, but it affects a lot of other diseases. So asthma, for example, can present quite typically with cough instead of wheezing in young girls. So when you think about asthma, you think about a typical sound that your lungs make, that your bronchi make when they contract. So it's a very high-pitched sound. Well, that's much less frequent in girls. They might just have a dry cough at night, and so they get diagnosed much later, or they get investigated later. When it comes to Alzheimer's, the behavior and emotional aspects that are connected with the disease are much more frequent in women, while in men it might actually present with the more typical symptoms that are frequently associated with depression, like apathy or physical impairment. Systemic lupus erythematosus, which is a relatively rare but quite well-known autoimmune disease, which is much more frequent in women, has a series of typical presentations. I could show you the picture from Netter's drawing. He also has a very, very good one about the lupus. Here, typical things are malar rash, so these are like red cheeks with a certain form, Raynaud's phenomenon, which is the discoloration of the fingers, and a lack of white blood cells in women. And these are the typical things we look for. While in men, it might actually present much more frequently as an inflammation of the internal organs or of the tissues around the internal organs, and possibly with renal impairment. Of course, these things are not so easily diagnosed, and although men are affected less than women, this might lead to also a much delayed diagnosis, and since the impact and the consequences of lupus are more severe in men, it might actually have an effect on their survival once they're diagnosed. Further moving on from the clinical presentation, if we look at diagnosis and management, when it comes, for example, to bladder cancer, we know that the diagnosis of bladder cancer is frequently delayed in women, because what happens is women go to the doctor saying that they saw a drop of blood in their urine, and what is investigated first is that they might have a urinary tract infection, which, epidemiologically makes sense. It's much more likely that they have a urinary tract infection, but they could also have bladder cancer, especially if they're older and have risk factors, and this might be investigated much later because we think it's not the case. The typical symptoms, and I put this here in quotation marks as I would have put in quotation marks the typical symptoms of the heart attack. The typical symptoms for depression, such as sadness, the tiredness, lack of energy that we associate when we have an image of a depressed person, are much more frequent in women, which frequently leads to an underdiagnosis in men, which might not report these symptoms. They might actually have a completely different behavior, where they become more aggressive. They might abuse alcohol and drugs as a reaction to the depression instead of having these typical symptoms. Osteoporosis is, in our minds, a typical disease of the postmenopausal women. And it is true that it affects postmenopausal women quite frequently. But if you consider that about 30 or even more % of the men over the age of 70 also have osteoporosis, and we don't screen them, and we often only diagnose them once they experience a bone fracture, we might actually want to reconsider this aspect altogether. And interestingly enough, this is a smaller study from Israel, which is quite indicative though. Multiple sclerosis is a disease, is an autoimmune disease. It's quite difficult to diagnose because it might come and then for years you might not have symptoms and then they might come back. It's tricky oftentimes to diagnose. And so the patients who have multiple sclerosis a lot of times visit a lot of different physicians before they get this diagnosis. And if you look at which kind of pathways these patients follow, well, men are much more likely to have encountered an orthopedic surgeon at a certain point in time, while women are much more likely to have encountered a psychiatrist at a certain point of time. So if there are dysfunctions, in men they're much more frequently reported to functional dysfunctions, while in women, what we first suppose is that maybe there is a problem, there's a psychiatric problem. Well, what does that mean for technology? So how do we deal or how does technology, medtech in this case, deal with sex and gender? Unfortunately, the solutions up to this point are mostly two. And the first one is this. So that's option number one. We make things pink and pinker. So we pink it and shrink them. That's basically how the Fitbit has evolved throughout the years. It became a lighter shade of pink, but that's pretty much the idea of how this could be adapted to a female market. And the second option is this. So this is the femtech market. And if you look at the femtech market, what you see is fertility solutions, period tracking apps, pelvic healthcare, pregnancy, sexual wellness, period care, fertility again, and then you have a tiny little field down here of general healthcare. So I'm not saying that it is bad, that the field, and I mentioned here breasts, ovaries, and vaginas, because this is what the field is mostly dealing with. So it's not bad in itself. It's important that we give attention to this field. However, I would like to see this much bigger, because what I'm seeing here is exactly the same thing that I've described before. So again, we're looking at the bikini aspects of the differences, while I would wish for applications that take sex and gender into consideration at all levels, at the general healthcare level, and not just when we're talking about my fertility. So let's take one step further. What should we consider when we include sex and gender into the development of digital tools and of technology? Well, the first question is, if you do it, what are you actually measuring? So what are you asking users to provide? Which kind of information, and why is it important? Well, first of all, I keep talking about sex and gender. And unfortunately, in the field I work in medicine for a long time, these have been used as synonyms. But yet they're not. So when we talk about sex and gender in medicine, we mean kind of two different things, which can be connected, but can also be separate. So everything that's biology, so hormones and physiology, chromosomes, genetics, that's this field. So sex differences. That's what we study mostly when we study cells, for example, or when we do animal experiments. Gender is everything around it. So when we talk about gender, there's at least 3 to 4 levels and many more that we can investigate. The first one is identity. So how do I feel? Am I a woman? Am I a man? Am I a non-binary person? What does that mean? And that's something that we as physicians can actually only know if we ask somebody, because this is something that's deeply ingrained in us personally. The second point is role. So what do people expect me to be based on the gender they see in me? So how am I supposed to behave as a woman in the current political and social context I live in? How does a man have to behave in a certain cultural and social environment in different times, for example? So what are the expectations? And then we have here relationships, which is really, if you break it down, the encounter between these levels. So my identity and the role that's projected on me come together. And what does that mean for interactions in the public, in the private? What does it mean for power relations? What does it mean if we have to navigate all kinds of decisions? And then there's this other level, which is not always investigated, but of course it's interesting if you look at the organizational and at the societal level, is what's the institutional gender? So what do we expect a CEO to look like? What do we expect a professor to be like? And for most importantly, what happens if you don't conform to these expectations? So if you are planning an app, or if you're planning a device or some kind of digital solution, what are you actually measuring and why are you measuring it? The second question is, does your product actually recognize your user? So this is work from Joy Buolamwini at the MIT in Boston. And she's a woman of color. And she was working with commercial facial recognition algorithms. So what she did was, one day she tried out one of those algorithms she was supposed to investigate, and she was not recognized by the algorithm. The algorithm simply did not even misgender her, like say you're a man instead she's a woman. It simply did not see her. So she said, well, there must be something wrong with these algorithms. Let's see what it is. And so she built an entire panel of faces. These are all members of parliament in different regions of the world. And as you can see, they go from really light skin and light hair to relatively dark skin and dark hair. You have women and men, they're blurred and non-blurred. And she tested the set. And what turns out is, If you are a white man, there's a pretty good chance that the algorithm is going to recognize you well. If you're a woman, your chance is much less likely. And if you're a woman of color, your chances are even worse. Now, it turns out that some of the algorithms do like women a bit less, and some do like people of color a bit less. So they are a little bit better, some a bit better in recognizing women, but some a bit better in recognizing men, regardless of their skin color. But overall, if you're not in the category of the light male, which is this one, as you can see, 0 errors here, your chances are slimmer. Why does that happen? Of course, because we train algorithms. We give algorithms data on which to learn and which to feed on. So if the set we're providing algorithms is mostly white men, the algorithm will be wonderful in recognizing white men. If we provide the algorithm with a diverse set, it might be much better in recognizing that. And that goes, for example, in the medical field. If I train an algorithm which is supposed to recognize melanoma, so skin cancer, only on white skin, it might not be able to recognize melanoma on dark skin. So it is quite important to do that for the application. The next question is, will your user actually be able to use your product? Left here is a former colleague of mine at Charité. So these are instruments you use for surgeries, and you have to hold them in your hand for a long time. This instrument was definitely not designed for a female hand, or for that matter, for the hand, a smaller hand of a man. It was designed for a standard giant surgeon man. This is your average cell phone. Now try to see if, as a woman, you can actually touch your fingers on this. So if you can actually use it in one hand, which was the initial idea behind it. Most likely you won't, at least not with the last editions. So in how far do you consider sex and gender differences or diversity, because it's not just about women and men here actually, in the development of your product? The next question that's also connected to gender, in this case to sexual preferences, to sexual orientation. How do you guarantee the safety for your user? So let's say you acquire sensitive data, acquire information about sexual orientation, about identity. This, just as an example, homosexuality is punishable by death in 12 countries in the world. So there is a certain degree of safety related to the fact that you're acquiring information about sexual preference, so gender identity. Trans people experience a lot of discrimination and can experience all kinds of harassment in many countries in the world. So if you acquire that information about gender identity, what do you do with it? How do you guarantee that your user is safe? The fifth part, and I think that might be the most relevant one, is will your user actually survive your product? So this is a chatbot which has been developed to give you advice on when you should seek doctor's appointment or when it is something not to worry about. So this is an example. This is something that has been put in here. A 56-year-old, 10 cigarettes a day smoker has had a painful left arm for the last hour and now feels sweaty and sick. I've showed you a picture before, so you have some ideas probably. So if you're a man, what it tells you is, well, you might have a pericarditis, which is an inflammation of the little bag around the heart, basically. This is usually treated in the emergency department. You might have unstable angina. This is usually treated in the emergency department. You might have a gastritis, which means you have an upset stomach. It usually requires seeing your GP. You might have a panic attack, so you can stay at home. Or you might have a heart attack. This is usually treated in the emergency department. So what you're probably going to do is you might go to the emergency department. If you tell the algorithm that you're a woman, you have two options. Either you have a panic attack, you can't stay home, just breathe. And the second one is you might have depression, where you might want to see your GP at least. Well, once you find out that you might have actually had a heart attack, and didn't go to the emergency department, I would probably be depressed too. But this is what you get here. You can actually use the hashtag death by chatbots and look up this product, which is kind of it exists. I'm not going to name any names here, but it is something that's quite interesting to see. And why does that happen? For the same reason that Joy Buolamwini wasn't recognized by the algorithm. How do we give data to these algorithms? How do we feed and train these algorithms? I'm losing my view. Okay, let's move to the last aspect of this. So what's the context? Who is developing this? So which factors are actually playing a role in here? Well, my first question here would be, have you, developer, ever met or talked to your user? So if this group has to develop something that works for my grandmother, they might be a bit off, or they might not even think about the issues that my grandmother might have. I'm not saying that this is bad per se. I'm just saying that if this is your developers team, you might want to look for advice, and you might want to talk to your user group quite intensely, because you probably don't even come up with some of the ideas that might be important to them. And unfortunately, this group is quite frequent in the tech industry, which might also be the reasons why femtech is what it is. The second question is, has your money pot ever met your user? And I call this money pot because your money, especially if you're a woman, can come from anywhere. It might be more likely to get money from your relatives than from venture capital. So what I'm showing you here, this is data from TechCrunch from 2017. The percentage of startups with female founders worldwide is 17%. It's actually increasing slightly. But then when you look at the risk capital attracted by female teams, it's 2%. Why? Because most of the capital funds are still in the hands of mostly male investors. If that plays a role, I don't know, it might. So, of course, there is a certain bias in the system, which also means what is being funded? Where is the interest? What do I even identify as something that is relevant for women? Do I think for women means femtech, as I said before, ovaries, breasts? Or do I think for women means that we need to use for any product, we need to make sure that it works for anybody? So my last slide and the mantras I would like to give to anybody who might be looking at this and wondering what should we do? Well, the first thing is you should look beyond the bikini. So it's not just what's evidently different that makes the difference. There's a lot of other steps beyond that, and we should take them into consideration. The second point is you should consider sex and gender and diversity overall in the team that is developing the innovations, that is developing the medtech solutions you're coming up with. If you don't have this kind of diversity in the team, if you don't have the representation, then at least consider having good user panels. Consider who is going to use your products and involve them in the development process. And this feeds very well into number 3. You should consider sex and gender differences at every step of the process, because otherwise we just have another pink bracelet. The point is, we should consider this when we decide which data to work with, how to analyze that data, how to incorporate that in the product we're developing, how to package that, how to make the tool usable for everybody's hands, and how to market it in the end. Number 4, it's always good to talk to somebody who knows how to deal with these differences. So find experts. I'm talking to you today, but I'm not the only one who knows about this. So find somebody in your area, find somebody you trust, and ask them about how this can be done. You're not expected to know everything, but it is quite helpful to get input and then educate yourself. 5, evaluate the science that backs your product for sex and gender sensitivity. So even if you've had the best intentions, make sure that the science you're using, that the data you're using to build your product actually considers sex and gender. Because as I said before, if the data is biased, and a lot of older data sets and even some data sets we're collecting today don't have this aspect in them, which means you will get the answer only for the people included in the data set. So make sure that actually the science that you're applying for the development of the product is also sensitive. Number 6 is evaluate the market for your product from a sex and gender sensitive perspective. So what do your users want? Actually, are you actually taking that into consideration? Are you actually developing a product that works for people? Is this what they need to solve their need or their issue? How can you, with what you're doing, fill into that? And are you actually considering the different facets of what people might need? And number 7 is really this. Talk about it. Spread the word. Let people know that this is important and address them towards potential solutions. And that's it. So with that, thank you very much.